Dr. Sandra Smit is here this morning to talk about a very, very interesting therapy called craniosacral therapy, and she's going to be telling us exactly what it is. And of course, our person that's lying on the bed, Megan, we're going to be performing on you, but I promise we'll be very, very gentle. Dr. Smit, how are you this morning?
Very well, thank you.
Very,
good to be on your show.
What is craniosacral therapy?
It's a big word.
It is.
Craniosacral refers to the cranium, which is the bones in the skull, and the sacrum, which is the last bone here at the end of your spine. And these are the places where the craniosacral therapist essentially hold the patient to induce a deep state of relaxation, which we call the parasympathetic tone.
Okay.
So it's a very gentle, soft touch therapy, and by using this deep state of relaxation, we actually get the body to unwind any blockages and any adhesions, obstructions in the flow of the various fluids in the body.
Now, what would you need to be going through to go for this kind of treatment?
As in symptoms or pains, it's excellent for any acute or chronic pain, injuries, trauma, slow recovery from illnesses, because it works on the nervous system, and the nervous system links to every other system in the body. Craniosacral therapy has a very large scope in treatment, but it's especially very good for anxiety and depression, panic attacks, fantastic therapy for that. Any stress-related conditions, insomnia, high blood pressure, and also nervous system-related disorders. Fantastic results with Meniere's disease, dizziness, any trauma, slow recovery illnesses.
So Megan is lying here very, very patiently. Do you want to show us exactly how it works?
Yes, certainly. So normally the craniosacral therapist would start at the feet.
Yeah.
And through a certain holding, we actually induce this parasympathetic nervous system tone. And the patient will then experience a deeper, resting, peaceful state. And their body starts unwinding. And already we start the therapy at the feet. We can feel that, for example, on her right side, Megan is holding tension, probably in her hip, lower back. And then there's a nice release.
What are you doing there? Are you?
I'm just supporting the heels, and because of the continuous flow of the cerebrospinal fluid, it produces a expansion and contraction that I can feel throughout the body.
Okay.
And I just assess that flow to feel if there's any adhesions or any obstructions or hindrances in the body that is caused by illness or tension.
And does it just happen at the feet
No,
area?
after working on the feet and inducing that deep state of relaxation, I move up. And then I put my hands anywhere. I usually slip it underneath the sacrum and the head to start off with, to get a further sense of what is going on in her system. And the connection between her head and her sacrum holds the cerebrospinal fluid around the spine and brain. And that circulation is of essential importance in craniosacral therapy. And it causes that gentle expansion and contraction that we look for.
And that's the results that she's going to be wanting to
Yes, she's going to feel a freer sense of motion in her body. She's going to feel lighter, more relaxed. And generally, if there's pain or inflammation, that would ease within the first or second session already.
Now, it is Breast Cancer Awareness Month. What homeopathic remedies would you have for that?
Actually, and as a matter of fact, recent research has shown that at the University of Texas, there are 4 particular remedies that they researched, Surya, Carcinosin, and 2 others as well, that are very effective in apoptosis, which is the natural cell death that is stimulated, in particular this case, in breast cancer. So that is a very good, effective therapy that goes along with Cranio to bring the body back to its natural state of inherent health.
Well, this is definitely something that we should be talking about more. Dr. Sandra Smit's information will be on our website at Expresso Show. Thank you so much, Megan. Thank you so much, Dr. Smit, for being here. We've been talking about alternative treatments for your health. So, of course, if you don't want to go with pills and tablets, this is a great way for you to go. Liesl, over to you.